Hello, I'm Dr. Mitra Motamedi. I'm a practicing family physician in Vancouver, BC, Canada. During the past year, I have provided various videos on topics related to ADHD. Every day in my practice, I see patients with ADHD who are struggling with addictions. My video today is going to address this topic of addiction and its relation to ADHD. Just to put addiction in perspective, in British Columbia alone, we have numbers that 16,000 people have died of unregulated drug use since 2016. Nationally, in 2024, an average of 20 Canadians died every day from opioid overdoses. A national study in the United States, references are included in description, found that about 1 in 10 teenagers and 1 in 5 adults had substance use disorder in the past year. Half of these cases started using by age 18 and 3/4 by age 25. These numbers are alarming. I want to stress here a very important point. Addiction is not about having weak willpower or making poor choices. It's a disorder, much like other chronic health conditions, and I'm going to tell you in this video why. So, what is addiction? What is substance use disorder? What are the definitions? There are several symptoms for substance use disorder. If someone has only 2 of these symptoms, there are 11 symptoms, 2 of these 11 symptoms are enough to actually get the diagnosis for substance use disorder. What are these 11 symptoms? If you see someone who is using more of drugs or longer than intended, that's one of the symptoms. They may have strong cravings and urges. They try to cut down, but they are unsuccessful. They spend a lot of time to get or use the drugs. They keep using despite negative effects on their health, work, school, home, social life, and their relationships. They typically give up important activities, and they may use drugs even in risky situations. They build up tolerance to drugs, so they need more for the same effect. Stopping drugs cause terrible withdrawal side effects. The more number of symptoms, the more severe is the disorder. So the question is, why are some people more vulnerable to addiction than others? Let's break this down into some details to better understand this critical question. First of all, some brains are more vulnerable due to genetics. Another factor concerns early life adversities, such as exposure to chronic stress, trauma in childhood, which can disrupt brain development. Another one is environmental factors, like ongoing high stress, peer pressure, and lack of support. What I see every day in my practice is patients who self-medicate themselves to cope with their other conditions like ADHD symptoms, anxiety, other mood disorders. Let me tell you how addiction works. The brain has a reward pathway that's linked to dopamine. Dopamine is our feel-good chemical. Natural rewards like food, sex, exercise can double dopamine levels. Nicotine can raise dopamine up to 3 times above baseline. Opioids up to 10 times. And unregulated stimulants like cocaine, methamphetamine can increase dopamine up to 10 to 20 times higher than normal. These substances hijack the reward system with a flood of dopamine, creating a powerful rush which is unnatural. For vulnerable brains, even one-time use can trigger a strong desire to use again. With repeated use, several changes happen in brain. In response to this high amount of external dopamine, the brain starts to adapt by producing less dopamine. So these people need more substance for that same effect. Over time, other natural pleasures are not appealing anymore, and these drugs become the primary source for dopamine. Brain cells adjust so that signals don't pass as strongly, and over time, brain circuits and pathways physically rewire, and it changes how motivation and pleasure work. We have wanting circuits and we have liking circuits. Dopamine-driven wanting circuits become hypersensitive, but the liking circuits don't change or may even decrease. So the brain learns to want the substance more than it actually likes it. It means cravings can grow even when the highs are not as strong. Environmental triggers, such as certain people, friends, places, events, smells, linked to past use, can activate some brain regions, become conditioned cues, and spark intense, often very difficult to control cravings. Together, these changes build tolerance and drive continued use, often just to feel normal. Now, I want to specifically talk about how young adults fall into the trap of addiction. The front part of the brain is called prefrontal cortex. That's the brain's executive center. It's responsible for decision making, planning, impulse control, and it's one of the last regions to fully mature, often into our mid-20s, like 26 years old. We also have circuits in our brain that control our impulses, which are not fully developed in young adults. One part of the brain that does mature earlier is our reward center. So just to put this all together, imagine a teenager whose executive center is not yet developed. Their inhibitory circuits to control impulses are not yet fully connected, but their reward center is already developed. This is why they can make impulsive decisions based on smallest rewards. So how does this affect children and young adults with ADHD? We know that there are 2 to 3 years of even more delay and a reduced connectivity in these people, in these children, making it even harder to stop and think before acting. Children with ADHD often face bullying, low self-esteem, social rejections, which can lead them to start using substances earlier. As they get older, if they may have other psychiatric disorders, which is quite common, these can fuel drug use even further. Starting substance use at a young age, when the brain regions are not mature enough yet, can change the brain's reward system and decision-making circuits, and it causes long-lasting changes in how the brain works. You may ask, are these changes permanent? The good news is that the brain has an amazing ability to rewire and learn new patterns. We call this neuroplasticity. With removing harmful triggers, therapy, medication, healthy habits, the brain can gradually restore its balance. It's very difficult, but it's possible. So now let's talk about the link between ADHD and addiction. Many people with ADHD use substances to self-medicate, but it doesn't help. It actually worsens their situation. Substance use disorder is one of the most common psychiatric conditions seen with ADHD. Up to 71% of ADHD people have some form of substance use problem. ADHD is linked to higher rates of all types of substance use, even behavioral addictions like internet gaming. Studies have found that people with ADHD start using substances at a younger age. They have a higher risk of using multiple substances. They have a lower abstinence success rate. When they get into the treatment programs for their addiction, the chance of sticking with the treatment is less successful. Finally, there are higher risks for hospitalizations and suicide. These risks are even higher when there are other psychiatric comorbidities together, like anxiety disorder, conduct disorder, PTSD, very common, bipolar disorder, again very common. The good news is diagnosing and treating ADHD earlier can prevent substance use. And treating ADHD in those who already have substance use disorder can improve outcomes significantly. This is why it's so important to screen patients with addictions for ADHD. Yet many addiction clinics in Canada still don't do that. I have heard that many addiction centers in the United States are now doing this screening, and it's my sincere hope that in Canada we will make it a standard practice too, to screen everybody with any kind of addictions for ADHD. In my next video, I'm going to talk about the most commonly used substances among people with ADHD, like cannabis and alcohol. I'll cover these in detail. Stay tuned, and thank you for watching.